Hello friends, in this video lecture we will discuss about medical termination of pregnancy, that is MTP or induced abortion. Intentional or voluntary termination of pregnancy before full term is known as induced abortion or MTP. What is here about full term? So, when pregnancy usually lasts about 40 weeks or 280 days from the first day of last menstrual period is termed as full term. In all over the world, 45 to 50 million MTPs performed every year, and this is about 1/5 or 20% of total number of conceived pregnancies that occurs in a year. Medical termination of pregnancy has a significant role in population reduction, but by these kind of act we are trying to reduce only those kind of population who are not fit in our social life, as there are a number of individuals who are suffering with a number of genetic disorders, who are suffering with a number of chromosomal disorders. So they are actually the challenged person, and this is highly controversial. So we are not going to deal with that, but here by MTP there will be significant role in population reduction that occurs every year. But this is not only meant for that purpose. That's why in year 1971 in India MTP was legalized. Why? Because there are a number of persons who are misusing this. That's why to avoid its misuse, there is, in which sense they are misusing this one, mainly in case of female feticides. That's why MTP was legalized in India by the year 1971. Now, why MTP is used? So this is to get rid of unwanted pregnancies that may be due to unprotected sexual intercourse, that is without use of contraceptives. This may be because of failure of contraceptives during sexual intercourse or coitus. This may also be due to rape, and sometimes the pregnancies are fatal or harmful. To avoid all these situations, MTP is suggested. MTP is considered relatively safe during the first trimester, that is up to 12 weeks or 3 months of pregnancy. If pregnancy is less than 10 weeks, then with the help of medication, that pregnancy can be easily aborted or performed MTP. But after 10 weeks, abortion with medication alone is not feasible, and termination of a pregnancy at this stage requires a surgical procedure. Second trimester is very much riskier. Why? Because at this time embryo is converted into fetus, and there will be formation of umbilical cord that connects the fetus to placenta and uterine wall of mother. At that time external sex organs also start to develop. So here there is huge risk for mother's body at this time. MTP must be performed legally by qualified doctors, not by unqualified doctors, or we can better say quacks, illegally. Most of the time this is practiced by quacks illegally. There may be huge risk of mother's body if there is such type of practice. MTP is also used by a number of person for female feticide. So MTP must not be misused for female feticide after sex determination, that is by misuse of amniocentesis or sonography, also known as ultrasonography or USG. So what is amniocentesis? It is a prenatal technique of studying the genetic and metabolic disorders of the fetus by taking out a small quantity of amniotic fluid that is filled inside the amniotic cavity. As we earlier discussed, human beings are grouped in amniotes. Amniotes are those organisms which have extra embryonic membrane around the embryo or fetus. So in human beings there are four extra embryonic membranes. This is yolk sac, allantois, amnion and chorion. Chorion is the outermost one, while inside this there is the next three. Amniotic membrane, this causes covering around embryo or fetus and is filled with a fluid that is known as amniotic fluid. This gives information about sex and chromosomal abnormality. If fetus suffers from any kind of incurable genetic and metabolic disorders, then MTP is suggested. But most of the time, there is no such kind of diagnostic use of this amniocentesis or sonography. After detection of sex, there will be maximum cases in India of female feticide. Now, what are the significance of amniocentesis? So, amniocentesis, as we earlier discussed, display a great role in decreasing human population, but amniocentesis is not mainly meant for this. If an individual fetus or embryo is suffering with any kind of genetic problem that is not curable, then MTP is suggested. So amniocentesis at that time may be helpful. Next, about the drawbacks. So as again we discuss, there is a huge or high misuse of MTP as well as amniocentesis for abortion of normal female fetus. It has raised many emotional, ethical, religious and social issues. So we have to restrict, as by Government of India in the 1971 this was already legalized, but we also have to take care